This computer. Okay, hello everybody. This is a new version of our lectures. We're going to record them for you and you can see them whenever you like. We are hosting today Dr. Alexandra from Swiss Medica, a very good friend of ours, to discuss adult illnesses, adult conditions. It's a very interesting presentation and you can either join in now or watch it later. So, Dr. Alexandra, I'm making you co-host. Hang on just a second. Make co-host. Here you go. Okay, the floor is yours, doctor.
Thank you. Indeed. And yeah, now we will start. And here today, I'd like to focus your attention on using stem cells for problems among adults. Last time we spoke about autism. Unfortunately, parents can also, and grandparents have diseases, and we will speak about it today. I'd like to remind you that all alive animals, including a human being, has ability for regeneration. And with different species in nature, it works differently because some can regenerate only limbs. Sometimes it can be even the whole part of the body. Yeah, like with some vertebrates and invertebrates organism, it can happen because it's a kind to be resilient, to survive, and this kind of regeneration also has some features among human beings. Yeah, so that is why we will return to our body, and each type of tissue can regenerate with its own speed. I'd like to focus to tell you about most common thing. For example, if we speak about cells of liver, every 300 days, these cells can regenerate. Let's say roughly once a year. Yeah, so we should be careful about liver cells because every year it has a chance to regenerate. Let's look at the tissue which has the probably very slower type of regeneration. I mean bone tissue, because it has a speed every 10 years. So our skeleton, yeah, can completely change every 10 years. And those cells which are doing it with high speed, of course, these are blood cells, because they have this chance to do it every 4 months. So let's say every 4 months, yeah, our blood cells can be renewed and regenerated. If we move further, we will ask a question: how does it happen? What makes this process of regeneration? What controls it? And the answer is the unique stem cell, which controls this process of multiplying, of renewing, of having certain amount of cells in our body. And in the center, you see this stem cell, which can really differentiate into any tissue of our body, and it is considered to be about 200 different types of tissues in our body, and all of them are having its own speed of regeneration and the law of regeneration. So the stem cells are unique cells. It's a special class of cells which can control self-renewal. Yeah, they have high proliferation activity, and they have potential for multi-directional differentiation. Yeah, when we speak about absolutely different diseases, yeah, there's a sense to use stem cells to intensify the regeneration of this or that tissue, including central nervous system, including blood cells, muscles, cells of immune system, and epithelial cells. There's a question, very common question among patients, where the stem cells are. Where can we find them? Actually, they are in all tissues of our body. Practically, there are several areas in the body from where these cells can be extracted more or less easily. And first of all, you see it is bone marrow aspiration, which gives us the chances to have the mesenchymal stem cells and hematopoietic stem cells from this procedure. And usually it is done in operating room under local anesthesia. It is enough not to have unpleasant feeling, and the specialist takes, let's say, 50 70 milliliters of the material, and then after centrifugation there's a special layer of cells which he takes and then use as locally. It depends on the problem, or it can be intravenous infusion. So this is one of the common way of taking the stem cells from the body. Another way is using, like also most common one, using lipoaspiration. It is so-called mini liposuction, when the tissue around navel, which is considered to be the area with a huge amount of mesenchymal stem cells. Also, under local anesthesia, this tissue is taken, and again centrifugation, and again we have the material with a huge amount of different factors, including growth factor. And locally or as intravenous infusion, this material, stromal vascular fraction, can be taken and used for the next step. As well, the source can be a dental tissue. Before it was used pulp mostly, but now many tissues of dental can be used as a source for the stem cells. Plus, of course, peripheral blood, but it doesn't contain too many stem cells to use for different diseases. So these are sources which we can use from the patient. If, let's say, his condition is quite good, if his age is good, and we understand that regenerative capacity of this person is at a very good level, and there is a sense to use autologous stem cells. In case when, by the way, here you can see in details the way of taking stromal vascular fraction under local anesthesia and centrifugation, and then having this material in the tube. We use it for this or that problem. Very often it is used right now in many countries for joints problems, as you know, and even for anti-aging procedures. We use it actively for problems connected with vision, with eye problems, and doing it retrobulbar, behind eyeball area, area that can be as a very good booster for optic nerve, for retina, and improving vision with local administration of stromal vascular fraction. As well, we do it as a parametal injection behind ear area subcutaneously for patients with hearing loss, with tinnitus. These patients could benefit from this procedure with stromal vascular fraction. But there are, here you see the mechanism. We came very closely to mechanism, how mesenchymal stem cell can work. Yeah, the mesenchymal stem cell and exosomes, which these cell produces in a huge amount. So the molecules and exosomes which are produced, they are great controllers of the regenerative processes in the body, and they control growing of new blood vessels. It is so-called angiogenesis, when new vessels start to grow. And in problematic areas, it means that there are more vessels, there's better circulation of problematic areas, and finally it can be better function of this or that organ. So the mesenchymal stem cells can control growing of new vessels and nerve terminals, which is important for such problems like neuropathy. It controls inflammation, and one of the main issue with inflammation, it definitely suppresses inflammation. So it can be neuroinflammation or inflammation in specific other organs, or inflammation in, let's say, generally in immune system, when it is more aggressive and shows signs of inflammation in general. As well, these stem cells, they controls the cell death, so-called apoptosis. Yeah, and because each cell in our body, it has special program, yeah, so functioning. When it start functioning, when there's the end, and new cell will come and support. So for such program, for the limit of each cell's life, stem cells can make this life longer. So each cell can function longer, can function at a higher level, at a better level, and that means this or that improving of the function of this cell. And of course, we should mention that stem cells automatically, when we speak about intravenous infusion of the stem cell, it's like a common way of administering the cells into the body. Automatically, they are attracted by inflamed tissues, or those tissues which where there is degenerative process. It is so-called homing effect. So in spite of the way of administration, we administered it into the vein in the elbow, stem cells will go to problematic area. This is for sure, and they will intensify differentiation of cells, means developing from immature forms, from, let's say, 0 level of development, into highly differentiated cells. When we speak about central nervous system, we mean that it will be a differentiation of neurons, and it will be more connections between neurons, formation new neuronal pathways. It will be suppressing of inflammation, which, if you remember this mechanism we mentioned when we spoke last lecture about autism. And then we see with the kids that their symptoms can reduce, that their cognitive function can be much better. And the same mechanism works for patients who had stroke, who had, let's say, some trauma or inflammation, encephalitis in the brain, that stem cells helps to control this inflammation, to suppress it. And as well, similar processes are happening in other organs. Yeah? They are happening when we speak about intravenous infusion. For sure, a huge amount of blood constantly go through kidneys. Yeah? And the same mechanism, if there is a problem there, stem cells will be attracted there as well, and they will do the same function in this organ as well. I mean, it will be blocked or reduced apoptosis. It will be increasing of cells proliferation. It helps to reduce or to block even fibrosis, developing connective scar tissue in the organ, and also controls inflammation.
Just to make clear that I understand. So if we have a person with kidney problems, okay, let's say this organ is starting to slowly lose function. When do they need to come for therapy?
Yeah, you see, the earlier the better. We shouldn't wait until there's the last stage of any pathological process, because the last stage means that the amount of functional tissue is very few. Yes, it's very few.
So
And
if they're on dialysis, there's no more chance to help.
At the moment, no, because stem cells therapy has also certain limit. And if we are speaking about last stage of kidney failure, when the GFR, it is a specific parameter which indicates how well kidneys are functioning. When it is very low, there's nothing at the moment in medicine that can increase this parameter, and that kidney starts functioning as before. There's no reverse, significant reverse for problems with the kidney with the last stage. At the beginning, it's a very good question from your side, because when we speak about the beginning of the problem and the chances for reverse and for more productive regeneration, they are much more higher in comparison with the last stage. Thanks. Probably if we have a man here, it will be clear and easier for understanding. If the car started problems, yeah, then it's better to do the repairing immediately. Yeah, not to wait, because then it will be longer, it will be problematic, more expensive. So of course we cannot make such comparison, but you see, when, as an example, diabetes, yeah, when certain stages of a pathological process are coming, for example, with vision, with retina, with kidney as well, because kidney, it's one of the organ which is also under the pathological process, then it goes gradually. And first changes, theoretically, it's possible a reverse with good control of A1C level, with diabetes, with physical moderate activity, with proper food. We can achieve good level of A1C level. It means no burning for vessels, no problems, and then finally reverse is possible. At the first stages, it is even called functional changes of this or that tissue. Sorry, I cannot hear you.
Okay, can you tell us a bit about liver diseases and what kind of liver diseases you treat and when they should come so we can have more of an understanding.
Yeah, for sure. Then I will, if you don't mind, I will skip a bit in front, yeah, because there was specific slide for liver diseases. When liver doesn't function properly, it has a huge amount of function in our body, and you see. Immediately liver problems can be seen with such symptoms like it can be chronic fatigue, it can be first of all yellow color, yeah, with high level of bilirubin. Jaundice can be pain or swelling of this organ, and with advanced stages we can see edema of legs and ankles. Very often jaundice can be connected with feeling of itchy constantly. Patients can feel it, and when we speak about jaundice, then automatically the urine has dark, very dark color, and pale stool at the same time can be, and nausea, vomiting, some general symptoms that something is going not so good, and loss of appetite, and very often with low level of platelets. People have problems with the clotting, and any kind of, let's say, touch can finally finish with a bruise. So the problems connected with the liver are very serious, and at the moment we see that conventional medicine cannot help properly with all categories of patients. One of the most difficult patients are with cirrhosis, yeah, with liver cirrhosis, and we saw many patients with the beginning of cirrhosis, and we saw that if, for example, some negative factor, very often, unfortunately, it was taking alcoholic drinks, when this factor was excluded and having the stem cells therapy, quite good results we saw among patients. With
maybe not with alcoholism, because usually they will not come in for treatment, but hepatitis C also damages your liver. So is this something that's reversible or treatable with stem cells?
Well, with hepatitis C, here we should be very accurate, and before arrival of such patients, we should have a very thorough diagnostic to understand if it is a tendency for malignant cells to appear. So definitely we do so-called alpha fetoprotein as a predictor of a possible transformation of the problem into the carcinoma, as an example. So that is why there's screening before arrival of these patients to understand their platelet level, albumin level, and stabilizing their condition. It is, let's say, the most realistic scenario that we can have, because it has tendency for progression. To cure this problem, unfortunately, no, but to achieve long-term remission, yeah, and this is the goal for patients with the hepatitis C.
Okay. So I think we can go back to the slides from before.
Yeah, for sure. We stopped here. we stopped, we continued discussion over the function of the stem cells, the therapy, and the exosomes which they produce, yeah, just as a part of cytoskeleton of the stem cells. These exosomes are actually like mini stem cells without nucleus inside, can easily go to all tissues, to any organs, including cardiovascular system, liver as well, which we discussed. Yeah, and in terms of using of application the stem cells, some problems we have covered, yeah, and some are worth discussion. I mean, problems connected with endocrinological organs, with high blood pressure, with ischemic cardiomyopathy, and with pulmonary diseases. As you know, we have after COVID infection, really we saw many patients with post-COVID pneumonia and patients with idiopathic pulmonary fibrosis, and using stem cells and COPD, of course, using stem cells for these categories of patients. Automatically stem cells can go to lungs because they are like filters. 50–60% of the stem cells can be there, can be absorbed there, and automatically activate regeneration of lung tissue. And good results we saw with minimizing fibrosis in the lungs and better functioning of respiratory system as well. Those diseases, autoimmune diseases, which are connected with immune system misbalance and autoimmune aggression, multiple sclerosis, lupus, Crohn's disease, are also good cured with stem cells, or at least not cured, but long-term remission can be achieved. For sure, many neurological problems, which are quite common, ALS, Parkinson disease, stroke, dementia, and common thing for women and men as well, anti-aging, as a chance to slow down the speed of aging, yeah, the speed of aging. As well, people with spinal cord injury, mostly we take patients with incomplete damages, not complete damage, when roughly we can tell there's no connection in the spinal cord at all, but when a certain amount of connection exists in the cord, then some changes with the sensitivity, with the functioning, insignificant changes we also saw among patients.
So it's a really funny story. When we first realized that stem cells can help, it was because when I was in nursing school, my professor said that in the future, we will treat spinal cord injury with stem cells. So when I first looked out stem cells, this is what I looked for. And that's how I reached Swiss Medica through through this program. And it's really funny because eventually what happened, they opened this amazing program that we have together. So even a small note in nursing class apparently can change things. So there you go. Now you know.
Yeah, how you came to us, yeah, to Swiss Medica. When we speak about different types of the stem cells which exist nowadays, and different clinics are using these or that types of cells, I should tell that we were talking about adult cells. Yes, we were talking about adult cells, which you remember we could take from bone marrow, from fat, from tummy area, from dental tissue, yeah, from blood. And There are cases when using autologous stem cells, because this material is called autologous, we cannot use for this or that reason, because of age, for example, because there are very serious comorbidities and some chronic problems because of age. For example, after 65, using own stem cells, of course it's possible, but it can this material can have very low regenerative capacity. That is why the alternative for such patients can be using donors material, using material from umbilical cord and from placenta, with really high regenerative capacity. The same mesenchymal stem cells, but from another source, which shows good results. Here you see the tissue of placenta, which is left after the child's birth, and the umbilical cord, this white cord that helps to connect mother and a child, and the source, the placenta-derived mesenchymal stem cells, can be used, for example, when patients have a high risk of bleeding and taking blood thinners, and using own stem cells can be postponed for this or that reason. And when patients cannot have anesthesia, so they are looking for alternative method where to take mesenchymal stem cells, and if, for example, some other reasons that really donors stem cells can be more beneficial. And these cells from placenta, for example, they really can show a higher level of potency and a higher level of efficacy. And when we started, by the way, using the donors material, we started to compare even among children with autism, because at the beginning bone marrow derived one procedure was used, and when we started to use donors material, donors mesenchymal derived stem cells, we saw that very often results were similar, and sometimes with donor cells there were much better results. And then we switched with kids and with many adults diseases on combination using, for example, own cells and donor cells, and this combination also showed quite good results. And you remember that some stem cells can differentiate into specific cells directly, or most of the stem cells have so-called paracrine effect. That means these production of exosomes, and in spite of the location of problematic organ, these exosomes can go anywhere to the via blood-brain barrier and control the neuroplasticity. They can have immunomodulating effect, which is very significant anti-inflammatory effect. It influences on positively on T regulatory cells, and just intensifies, as we mentioned, angiogenesis, and blocks fibrosis and apoptosis. So the stem cells and these exosomes with paracrine effect are quite beneficial, especially among among youngest cells. I mean stem cells derived from placenta and umbilical cord. When we speak about some specific diseases, now we started to talk about specific diseases, all symptoms for sure because diabetes type 2, it's quite common problem. Here you can read and see effects which we saw among our patients after using mesenchymal stem cells. What we saw that patients after a certain period of time, usually it is 1 month and a half, 2 months period until 6-8 months duration. It's a time frame to observe changes connected with the regenerative therapy. Patients told that their general health condition was much better. The parameters which we controlled, even fasting glucose, A1C level, C-peptide, they changed with the positive dynamics. And the amount of medication, the dosage, and amount, because sometimes it's combination. Very often not only one medication helps to control, but 2, sometimes even 3 medications people take. So these medication, the dosage, they could reduce. That is a very good sign. And we shouldn't forget about common recommendations with physical activity, controlling weight, diet, proper diet, all together could bring patients to very good results. One patient from the United States, he's on our website, Joseph Anthony Jerez. He came, it's a bright example because really after having stromal vascular fraction, his basic parameters with diabetes improved greatly, and he even stopped taking medications. For sure, he changed his diet and physical activity, but he was one among the patients with this disease that showed brilliant results, I should say. And I saw also patients in our clinic who had, because of high level of glucose, very often patients have ulcers or the problems with the skin that it recovers, it regenerates really very, very slowly. And it is scientifically proved that ulcers, after the using stem cells and local application of exosomes, the speed of recovery is faster and the size of ulcer was reducing. Even I will tell you that one my colleague, his grandma told that because of diabetes, one ulcer appeared, and we decided among colleagues to try not the stem cells therapy like main procedure, but even using exosomes to apply locally as masks. And after 5-7 days, when he made pictures, when he took pictures of these ulcer, we saw, and the surgeon also observed the situation, that the size of ulcer became smaller and smaller. And then finally it was completely covered. And that was quite good, because conventional medicine, standard protocol, ointment, things that they used didn't help. So that
For
is
diabetic wounds, there's nothing we can do today. Not even here in Israel. We have many different therapies, but we cannot do anything today for diabetic ulcers. So diabetic foot for us means only one thing, and it's not good. It's basically a one-way ticket. There's no coming off for this train. And one of the things I tried when I was working in orthopedics is to try to make the connection between you and the department here in Israel for orthopedics. Unfortunately, it wasn't successful because of our Ministry of Health, not because of lack of will, but seeing the results of Dr. Mikhail's research, I was shocked. I never saw something like this ever, not in my life. So I'm very hopeful that in the future we can offer this kind of treatment because these are not traveling patients usually, unfortunately.
I see. For sure, the golden standard for such patients with diabetic foot, good controlling of glucose, yes? Achieving good control, because then it's better for vessels and for ulcers to recover. And but really, when we are speaking about very deep size of ulcer, when sometimes bone is seen, yeah, then it's really serious problem how to cover this let's say minus tissue, yeah, when it is very serious defect of the skin, and what to do. And the edge of these ulcers, which let's say a live tissue, when they have this support from let's say stem cells, from exosomes, for sure speed of recovery is better. We shouldn't forget that inside exosomes, they can deliver even mitochondria, energetic factory of each cell. They can deliver to damaged pathological tissue. That can be one of the mechanisms of faster recovery of tissues. The next, now I hope it's clear with this problem. If someone from people who are listening have questions regarding the diabetes, please feel free to ask, because then we'll switch to another disease.
I think we will do questions in the end. There are some people listening, but we'll do questions.
Okay. Okay, as for liver cirrhosis and the C hepatitis, which we talked about, yeah, it's clear. And of course, hepatitis C, these patients should be under very thorough control of specialists with regular monitoring parameters and activity, yeah, and which antiviral medication they should take, and so on and so forth. In case of neurological disorders, it's also very big problem for patients, especially of the elderly group. And
so you have a diabetic question. Sorry. Does it help with the condition of pre-diabetes to monitor sugar levels?
Now, yeah, as we told, it's better to start changes at the beginning. Yeah, and even with pre-diabetes, if to follow common recommendations, which I'm sure you know about it, moderate regular physical activity, number one, diet, number two, very good results can be achieved, which will prevent further development of the disease and then really diagnose diabetes. So with pre-diabetes, if person knows about it, he's a lucky person, because he can skip the disease, the pre-disease, if I can use this term, back, and live a healthy lifestyle. We shouldn't forget that people with even pre-diabetes, they have problems, the beginning of problems with vessels, and these can end with stroke, with infect, yeah, and the high percentage of invalids are diabetic patients. So that is why if to go to this problem wisely, then complete recover and normal, good quality of life can be achieved. And stem cells, it's like instrument that definitely can help. Yeah, with intensifying metabolism, improving A1C level, reducing it to normal range. But from the side of patient, also certain steps should be done, which we talked. Physical activity, diet, controlling weight.
Okay. If you can continue with neurological disorders, that would be good.
Yeah. Most common problems which we see in the clinic, and really they are all over the world. These are patients who had stroke, patients with Parkinson disease, yeah, like constantly progressing neurodegenerative issue, Alzheimer disease, yeah, among young people, multiple sclerosis as a disease which trigger is connected with autoimmune aggression of myelin sheath, and as well sometimes we can have patients with ALS. Yeah, when motor neurons are dying, and then patients are losing ability with movements. And what we saw with the stem cells therapy, what results we could see, especially with neurodegenerative diseases. We saw that many patients could achieve long-term stable period and some improvements with symptoms. For example, with Parkinson, it can be less spasticity in muscles, better balance, better emotional condition, because these people they have problems with emotions, with expressing, and with Alzheimer disease, the period of stability maximum that we observed was about 1 year. One such patient came every year to us because family saw that mother was quite stable and without further progression of the disease, which was good. So doing it on a regular basis when it works, it's worth doing it. And the same about ALS. Maximum of stabilizing period was for 1 year. And again, patients saw they were inspired by such results and came for the therapy once again. As you could observe with neurodegenerative diseases, people are repeating this therapy to have more chances for stability. With MS, it could be 3-5 years. It depended on the type of multiple sclerosis, but definitely anti-inflammatory effect and immunomodulating effect. Patients saw that at the beginning could be seen with improvements of symptoms. And in terms of effects for central nervous system and peripheral nervous system, we see that stem cells therapy helps to slow down the progression of the disease and slowing down degeneration of brain cells and helping to delay the worsening of symptoms. Very often patients could show improvements with cognitive function, yeah, and that they could show better ability to concentrate attention, better ability to memorize and express the ideas, especially with dementia for these patients. and what else we should say? Improve brain function with regeneration of brain tissue. We will
I think
ask.
it's good to pass to Crohn's disease. I think this is the most interesting part for today.
Okay.
Because before we spoke about it a few months ago, I didn't realize that gastrointestinal problems can be treated with stem cells. So I'm very curious to know what kind of diseases do you think? I know you know that two of my boys have gastrointestinal autoimmune disorders. So it's very interesting to hear how does it work? How does it get from our arm to our stomach?
Well, as you remember, and you know it practically, that stem cells mostly we administer into the vein, and with blood flow, stem cells for sure will go through the whole body. And they can feel specific markers of inflammation, which are produced if, for example, intestine is involved into pathological process. That means with these markers of inflammation, stem cells like magnet and the exosomes mostly go to intestine, to this area. And sometimes for such patients, if I mean they are not children, sometimes even rectal enema we can with exosomes administer, and we see that locally, even when they are absorbed in the lower part of intestine, it also locally have anti-inflammatory effect, yeah, for the tissues. It helps to minimize inflammation, and finally, it can be the reason for, after inflammation, it will be better regeneration of tissues, and we are talking about achieving remission then. We don't say that it's possible to cure completely, if we speak about Crohn's disease, this problem, but to achieve long-term remission without symptoms, without manifestation for some time, it's possible to do.
So let's say I have a patient here in Israel that wants to receive these enemas. Can they purchase them and have somebody bring them here? Or they have to do them in the clinic?
Well, very good question. I think because of volume that is necessary for each administration, I think that it is better if the patient will come to clinic, because for nasal spray, yeah, for neurodegenerative diseases, for autism as well, which sometimes we practice and patients come, the family comes and have nasal spray with exosomes. It's a small volume. For enema, it is a bigger volume, and it's better to have this procedure in the clinic, I mean.
Okay, I will definitely, when we come to the clinic in a couple of weeks, we'll take pictures of what it looks like, because I think here in Israel, we have a large population of people with intestinal problems. It's a very known Jewish problem, I know. But I think that if there is a way for us to import this kind of treatment, a lot of patients can enjoy it, and I will definitely look into it. But it's really interesting because up until now, I didn't realize you can give enema with exosomes. It's very interesting to know.
Yeah, like we mentioned with ulcers, locally as a mask, it can be applied on the skin. Here we are speaking about administration in such a way.
Yeah. Okay. So I think we can go on to the next subject. And I think after that, you are done and we can have some questions.
Yeah, we skipped to kidney failure, yeah, to kidney disease, and with today I spoke with one lady from Canada, and she told that she doesn't have. She is on the stage fourth of kidney failure. She doesn't feel it at all, so no symptoms. And she did on a regular basis a blood test and saw that her creatinine level was very high, urea very high, and GFR also very low. That indicates about serious problem, but no swelling of legs, nothing that could make you think about serious problem. And she told that um, she connected 25 clinics all over the world about the stem cells therapy, and many of them promised to have at this stage 50% of regeneration, possible regeneration of a kidney. To be honest with you, at this stage, I'm not saying about stage 5, I mean last stages of the problem, we have never seen, and I've never read about such clinical cases when it was a chance to restore kidneys functioning, to reverse the process. Again, we are speaking about the long-term stability. Sometimes it could be like 1 year, but then sooner or later the disease can progress, and which will finally lead a patient to dialysis or the kidney transplantation. With the beginning, stage 2, stage 3, it's easier. These patients can be stable much longer with following the recommendations from doctors. But with a stage 4, and she expected 80% even, I told that it's not possible. It's not possible. Stem cells, it's not like a miracle that with this type of problem can fix it completely and help in reversing into stage 3 or stage 2. But I think, and we saw that our patients, even once, I remember we had a person with transplanted kidney, but his diabetes was not very stable, and he decided, he came and taking even immunosuppressive medication. He got benefits. He those symptoms, I mean, more energy, more stamina, he told that he had from this therapy. But with kidney, yeah, it is still in stage of collecting information, and with safety, it's clear, yeah, there shouldn't be any negative impact for patients with chronic kidney failure. And but as for the efficacy, and again, significant improvements with GFR, then here we have not, very significant improvements.
So if you want to come for treatment, for kidney treatment, you have to come in the beginning. So stage
Yeah.
2, stage 3. After that, maybe it's not helpful as much.
Yeah, you're right. Yeah, and yeah, thank you for your being here today, and for questions, and I'm sure some new questions you will ask, and with great pleasure I will answer.
Okay, so now if you can unshare the presentation, I will stop the recording and allow people to ask anything they want. So unshare your presentation for a second.